Hi there, and welcome to our series on mental health. My name is Dr. Hasnain, and I'm a family physician with additional training in psychotherapy. Today we will be discussing two common mood disorders, anxiety and depression, and particularly how it relates to the current pandemic with COVID-19. We will also be discussing some healthy coping mechanisms as well. So let's get started. First, we're going to talk about anxiety. So how common is anxiety exactly? Anxiety is actually very, very common. 1 in 4 individuals will be diagnosed with anxiety during their lifetime, and this does not include the subclinical group. Subclinical anxiety is not included in this statistic. Now, given the era of COVID-19, where it raises fears and apprehensions and worsening anxiety, this is kind of a normal response to an environmental stressor at this level. So we're seeing that with COVID-19, we're seeing individuals that are having worsening anxiety just because there is so much unknown. So how exactly is anxiety experienced? Well, anxiety can be experienced in many different ways. Physical symptoms include your heart pounding, feeling hot, you can feel shaky, and you can even feel fatigued as well. These are some of the physical symptoms that may be experienced with anxiety. Now, in terms of anxious behaviors, you can have that as well, and that can manifest in ways such as hoarding or not leaving the house even when it's safe to do so. And lastly, anxiety can manifest as anxious thoughts as well, that can be quite distressing. So how is anxiety being experienced during COVID-19? What are the factors that is contributing to the overall worsening of anxious behaviors and thoughts and physical symptoms as well? So with COVID-19, we're seeing, there's a lot of uncertainty. There's the fear of illness. There's the fear or the responsibility, feeling responsible to protect family members. There's issues around being able to navigate social distancing, being able to navigate these conversations with family members or friends who may not have the same view as you, and being able to navigate it in a way that it doesn't harm the relationship. And even simply just knowing how, with the evolving situation, how to properly social distance can be quite anxiety provoking as well. Aside from that, there is a lot of financial worries as well. When we're seeing that a lot of individuals are being laid off, there's increasing worries about what the future entails in terms of financial stability. So we're going to talk about a few strategies in terms of how to cope with all of these worries and new situations. However, we're going to first discuss depression and how it relates to COVID-19. So let's talk about that first. So what are the emotions associated with depression? Well, with depression, we see the sense of hopelessness and despair, and the idea that there's a loss of control over one's own situation, and certain factors are worsening these emotions and these thoughts as well, particularly loneliness. We're seeing, with social distancing, loneliness is increasing, and this negatively impacts depression and makes individuals feel more isolated, and their support network isn't there for them anymore. So the idea, on one hand, we have the spectrum of individuals experiencing loneliness, but on the other hand, we have individuals that are now having to spend time with individuals that may not be healthy relationships. They may be spending more time with individuals that are more toxic, and unfortunately, it may be individuals within their home. We're seeing more, increase in terms of abuse as well, domestic violence. So this is because of social distancing and the quarantine and the current situation with COVID-19, where we're seeing either individuals experiencing loneliness or the opposite, where unfortunately they are spending too much time with individuals that may be toxic for them. We're also seeing an increase in substance use that can worsen depression as well, when you're self-medicating by turning to alcohol or other substances, and this can worsen depression as well. So what are the physical symptoms associated with depression? Well, the physical symptoms associated with depression include disturbances in sleep, and this can either mean too much sleep or too little sleep. Another symptom is fatigue, and decrease in terms of interest in activities that you previously enjoyed and loved. You no longer find it to be interesting. There's no energy, there's no motivation to participate in those activities anymore. You can experience a decrease in appetite as well. So these are some of the symptoms, physical symptoms that you can experience, in addition to the emotional experience of feeling depressed and hopeless, and an overall feeling of despair as well. So now that we briefly touched upon anxiety and depression and how it relates to COVID-19, let's now talk about healthy coping mechanisms. What is it that you can do to allow you to experience better emotional health and to feel like you have more control over the current situation? Well, the very first activity that I recommend that you do is called the circle of control. And this is essentially, just drawing a circle on a blank piece of paper. And according to the situation that you're in, I want you to write down all the factors that you do have control over inside the circle. And anything that you do not have control over, you write that outside of the circle. And what this does is it's a visual tool to allow you to see very clearly where you should be focusing your energy in order to bring about positive change in your current situation. So things that are outside of the circle, those are the pieces that you need to work on accepting, acknowledging and accepting that those are situations, or those are factors that you cannot change, but rather you accept it for what it is. Inside the circle is where you should be focusing most of your energy in terms of, what are things that you can do to bring about positive change. So let's discuss some of those things. The first thing that we're going to talk about is routine. Routine is very, very important. Being able to, wake up at the same time every day and being able to incorporate a set of routine for yourself and your family members, especially your children, it's very helpful because it's comforting and it's soothing to know what the day will entail. That's an area where you can exert some control and know what's going on in the world of uncertainties and lack of control. So being able to know what that routine will be for the day, and being able to visually have a chart for kids, for example, where they know when meals will be and what activities they'll be doing in between the meals as well, then that's something that they find comforting. And for yourself, you can also block out times where, the children, they know that there are certain periods of time when you will be busy because you may be working from home. And it's all about communication and having that routine established as a family activity, so that everyone knows what the day will entail. So that can be very useful. The second thing is going back to the basics. This means being able to move your body, being able to sleep well, and being able to eat nutritious meals. These are the basics, right? So it's really important that you're getting physical exercise. You're getting out, you're incorporating some sort of physical activity throughout the day. And you should cater that to your level of fitness. But even something as simple as going for a walk in the neighborhood for 20 minutes, that is very beneficial to your overall health. So that's very important. Move your body. And secondly, sleeping well. Making sure you're getting adequate amount of sleep and that generally you're waking up at the same time every day. That is one of the pieces of sleep hygiene as well. So making sure you don't have any electronics near you, you're getting adequate sleep, and that you're waking up generally the same time every day. And lastly, nutrition, focusing on nutritious meals and practicing physical distancing from your snack drawer is a must. It's okay to be eating, a few snacks here and there, but if you find that you're going through a bag of chips or that you're finishing, an entire box of chocolate on a daily basis, then that's something that you may want to reconsider. So being able to focus on nutritious meals, that's very important. So far we've talked about routine and coming back to the basics, which includes moving your body, sleeping well, and eating nutritious meals. Lastly, point number 5 is to connect with others. We are social beings. We need to be able to connect with our family and our friends and our loved ones. So make sure you're taking time to do, either FaceTime, Hangouts, whatever, Zoom, whatever platform you want to use, being able to do that, or being able to visit family members while still maintaining social distancing protocols. You can still go out for walks, etc. So it's really important to make sure that you are taking care of the social need as well. So these are just some general healthy coping strategies, and I would really encourage you to reach out to your family physician to discuss this in further. Some other resources that you can utilize are Bounce Back, which is a program through 𝐃𝐈𝐒𝐂𝐋𝐀. You can self-refer to this program for free therapy and coaching, essentially, on the phone, and it's a really great service. So if you feel that you need to reach out and speak to someone regularly, then Bounce Back Ontario would be a really good platform. Also, the Big White Wall, it's a peer-to-peer support network with lots of other resources as well. So I would highly recommend that you check out those 2 resources. And lastly, just being able to YouTube any kind of meditation or mindfulness exercises where you will be guided through these exercises would be very beneficial. I hope this was helpful, and I will see you next time. Take care. Bye-bye.